I'm Tim Hartnett. I'm the Executive and Clinical Director of Shine a Light Counseling Center, which has offices in Santa Cruz, Watsonville, and Monterey. We have a dual mission of providing low-fee counseling to the community and nurturing and training the next generation of therapists. So we offer counseling to the communities in Santa Cruz, Watsonville, and Monterey. Our clientele are a wide range, children, adolescents, adults, couples, families. Um, uh, we get a fair number of people who are lower on the economic scale. Our associates see a lot of Medi-Cal clients. Our trainees can't see Medi-Cal clients, so our trainees see mostly people low on the sliding scale, although there are some people who are higher on the sliding scale too. Presenting problems are, again, a wide range. It's a community counseling center, so we don't focus on any specific issues. We get eating disorder, substance abuse, really a lot of depression and anxiety, behavior problems in kids, and couples conflicts, family conflicts, wide variety of issues. So it's a good place to get experience in a lot of, with different types of clientele and with different types of presenting problems. At Shine a Light, it's a little different than some counseling centers in that we don't have a separate intake process. So when we get client inquiries, they get channeled directly to our trainees. So our trainees get experience with making the initial phone call where they have to screen to the client to find out if they're a good fit for the agency or good fit for the client. The trainee also does all their case notes and does the billing. So in a way, you get experience with a lot of the things, the full range of things that a private practice therapist has to do, as opposed to just having a single role in an agency of seeing the clients and then all the administrative work is done by somebody else. But basically the trainee attends group supervision, gets individual supervisions, and then does all their communication with their clients and sees their clients. The clients fill out a web form or leave a voicemail, and we try to get them to leave the minimum information that we need to assign them to a counselor. So they'll say what office they're at, how they intend to pay, what's the issue they want to work with, and what is the unit of treatment. Where is it a child themselves or family members? And when are they available? And from that information, our intake coordinator is then able to send that information to the trainee to make the initial contact with the client. One of my philosophies as director is that people enjoy their work the most when they have more sense of choice. And so we do offer pay to trainees if their caseload gets over a certain amount. Our structure is that the first chunk of money that the clients of a trainee pay go to paying Shine Light's basic costs. After that chunk is taken care of each month, then the trainee gets a certain percentage of the fees. It's not very much. With a trainee, it's a better deal for associates once you graduate. Most of our trainees stay on as associates. But that means that what we want is the trainees to earn that initial chunk. So we want them to have enough clients to do that, which is usually in line with what the minimum for their grad program is, maybe 5, 6 clients a week. But trainees can see up to 20 a week if they want to. Not many of them do. Most of them stay around 9 or 10. Some of them go up to 15. Occasionally there's somebody who goes up to 20. I'm the leader of all the group supervision except in Monterey at this point. And then we have a pool of individual therapists, private practice therapists who see, who provide individual supervision. So everybody gets somebody different as their individual supervisor from their group supervisor. And that individual supervision is scheduled at the convenience of the supervisee and the supervisor. So and trainees also get to request what hours they want to reserve office time for. So we're pretty flexible in how we can schedule. There's potential that we wouldn't have office space available at the time somebody might want it. But in general, we try to get people office space when they want it so that they can define their own schedules. The one thing that they don't define is the 2 hours of group supervision every week is a fixed time, usually a weekday morning. At this point, we don't have a comprehensive training with a comprehensive curriculum. We are a continuing education unit provider for the local therapist community. So we sponsor workshops in the general community, and licensed therapists who obtain CEUs, but all Shine a Light staff gets to attend them for free. And those workshops are on pertinent topics, but there's not a coordinated curriculum. So there might be one on couples counseling, there might be one on sex therapy, there might be one on internal family systems. It depends on who in our pool of presenters is inspired to lead a new workshop. In addition to that, there are some in-service trainings that we provide just to Shine a Light staff as we identify needs and interests in the staff. We may eventually come to the point of having a year-long training component that it is at a regular time all year, but we're not quite there yet. At Shine a Light, with the emphasis on being able to make your own choices, it does mean that people who can operate independently function better. In interviewing, I'm always looking for the capacity to deliver empathy and to develop good rapport. I like to have people be conversant in some kind of therapeutic orientation. Hope that they're at that point in their graduate program that they can do that. So, I taught theories of psychotherapy at CIS, and no, I didn't teach it at CIS. Taught group process at CIS, and I taught theories of psychotherapy at JFK, so I can speak different orientation languages, which is helpful in group supervision to be able to translate what somebody's saying from the jargon of one orientation to the other. But trainees are just learning a lot of different orientations, and so aren't expected to be conversant like that, but enough understanding of theory to be able to frame, at least begin framing cases within a theoretical orientation. I should say that I do have a broadly humanistic orientation myself, so the group supervision is in that realm. I'm always hoping to help people make their therapy sessions be more experiential, because I think that's a deeper learning when there's actually some change happening in the therapy session and in relationship with the therapist. But So that tends to be my bias in the group psychotherapy, but our individual supervisors range in their orientations, and people can choose the one that fits for them. Confidence is always one of the things that they're dealing a lot with, because eh, it's such an art, and you don't know going into a session what's actually going to happen, and it's only through experience that you build confidence in yourself that you're going to be able to handle the unknowns that come up. So that's a big thing that trainees have to deal with. I don't think there's anything about Shine a Light that presents trainees with any significant bigger challenge. I mean, they often have difficulty, particularly if they have to work at a paid job while they're also going to school and then also doing a practicum. Then it can be pretty overwhelming. That's what I hear a lot. If you're from Monterey, we often uh, particularly need therapists in Monterey or Watsonville. Um, um, Most of our trainees stay on as associates until they get licensed, because my main focus, um, in addition to providing the supervision for cases, is to be community building, an agency where people develop relationships with each other and feel the personal support to develop as therapists, because that job requires a lot of personal growth for as long as you're engaged in it.